It's a real pleasure to be here with you today. I love coming to Australia. I've formed some really wonderful friendships here. And one of the things that I wanted to talk about was just how friendly and giving and warm Australians are, and how it's really touched me heart-wise. But on with the business of the day, and brief overview of what I'm going to be talking about. I want to talk a little bit of a scene setter in Australia, because I think you're very much further ahead than many countries around the world when it comes to workplace mental health and the work that's been going on here. So that's a huge advantage. And I did a little bit of homework to sort of take a look at whether or not Australians are prepared and ready to undertake something like this. Also, I want to talk about a program that we've developed in Canada, the first of its kind, national standard for psychological health and safety in the workplace. And the case study that we undertook to get a better understanding and look at providing tools to others, sharing information so that it's easier for them to undertake this kind of project. Something that's near and dear to my heart, stigma reduction. And as you'll learn, that unless you begin to tackle stigma, it becomes very difficult to do many other things. And we've heard so much about stigma in different forms today from some of our speakers. I'm also going to talk about a program that we've initiated called the Working Mind, which is one of the tools I think that can be effective for many workplaces in terms of a foundational piece, beginning that work to change the culture in the workplace. And the approach that we've taken, if I leave you with no other messages, then if you are going to adopt a program, make sure that that program is evidence-informed or evidence-based. There's so many programs out there that are basically people's best guesses, hunches, and really don't have the data to back them up. So that's what I'll be talking about briefly today, just to provide you with that overview. So $200 billion. When I was doing some of my homework, I was shocked to find out that's what the folks who prepared the Fairfax Lateral Wellbeing Index say that it costs Australia every year, mental illness. And what they essentially say is that the traditional evaluation of mental health, sort of looking at it from an economic point of view, really misses so much, that people with a lived experience or poor mental health have lower levels of well-being, and that's how they're able to come up with that figure. So you'll see that I provide citations with all of the figures that I'm presenting in Australia, so you'll be able to look those up yourself to get more details on those. But let's take a look at a more traditional sort of look at mental health and the direct economic impact in Australia. And we heard Minister Davies talking about it and the potential savings that are out there. And in fact, I would say that this is probably a considerable underestimate. You take a look at absenteeism, you take a look at presenteeism, you take a look at the cost of compensation claims. One of the things that's not factored in here is the cost of medical services, again, which really begins to drive up those costs. Looking outside of the workplace, when you're talking about students in university who are experiencing difficulties, the elderly who are experiencing difficulties and require treatment, that cost goes up very, very quickly and needs to be addressed. Talking about readiness to accept change in the workplace, change in culture, that's going to be another theme that I'm going to be talking about. Certainly when you take a look at employees and how they feel about mental health in the workplace, interesting to see that 91%, greater than the number who actually think physical safety is important, support a change, improve mental health in the workplace. So that readiness is there, that acceptance. So that's why I was saying that Australia is so much further ahead in terms of laying that groundwork and being able to make it acceptable. So the readiness is there. Interestingly enough, though, only slightly more than half actually believe that their workplace is mentally healthy. And most don't believe that their leaders are in a position where they value mental health. So that needs to change a little bit. Again, I think you're on the positive side of that, but there's certainly room for improvement. Take a look at the benefits of promoting mental health. Really interesting, and again, this was a study that was done for Beyond Blue. Take a look at the difference between those employees who work in a place or an environment where they think it's mentally healthy versus one where they consider it mentally unhealthy. In terms of reporting being off because of not feeling mentally well, or noticing or observing fellow colleagues and employees who may be experiencing problems. So you can begin to see the difference. So the data is there, it supports that this is a direction that really we need to move in. And you heard Minister Davies talk about this in terms of the return on investment. We're doing this because it's the right thing to do, but there's a side benefit to it as well. So for every dollar you invest, there's a 2.3 return on investment. How can you argue with that? You're actually making money if you're in the private or public sectors and saving. So enough about the groundwork and preparations that have been done here in Australia and some of the interesting statistics around it. I'm now going to move to our programs in Canada and sort of perhaps a starting point for you. I wish there was a magic pill, a silver bullet that addressed everything. There isn't, but there are places to start. For us, one of those places is the National Standard for Psychological Health and Safety in the Workplace. We launched this program back in 2013, and we had some help in terms of developing it. We brought the Canadian Standards Association and an organization in Quebec known as the BNQ, the Bureau de Normalisation de Québec. These are two groups that are expert in terms of developing standards, things like occupational safety and other standards, to get behind this, to make sure that we were doing the right thing. And so these programs are essentially, or the standard rather, is designed to provide a voluntary set of guidelines, a framework, a starting place. Now, I'll also be honest with you, and my colleagues who sort of helped develop this would hate me saying this, it was a little bit high level, and we kept getting feedback. So, yeah, we understand it's a framework, but how do we actually roll up our sleeves and get engaged? And that's when we developed Assembling the Pieces, which essentially is a step-by-step process in terms of how to set up your own standard in the workplace. Now, interestingly enough, for about the next 6 months, the standard is free. We've had it for free for 5 years. CSA essentially distributes it for the Commission. They generally ask for your email address, and that's primarily in case there are any updates, they can keep you updated. And again, the Assembling the Pieces is free if you get it in a digital version. If you buy a hard copy, there's a cost involved. But again, these have been very, very successful. Now let me tell you a little bit more about how these particular programs work, particularly the standard. So if I was to use an analogy of building a house, a metaphor, what you're looking at are 5 basic elements or key pillars that go into making up the standard. Programs, policies, benefits, training, and importantly, assessment, making sure you know what you're doing is actually working and delivering on the outcomes that you're looking for. So when you're talking about programs, you're talking about workplace awareness, education for employees, policies, dealing with issues like bullying and harassment in the workplace as not being acceptable and becoming core values within your organization. Benefits, things like EAP and EFAP programs, making them available, accommodating staff so that they can take time off work for appointments, also helping support them if they need psychological assessments. In Canada, I'm not sure what the situation is here, psychological support isn't paid for as part of our universal health care, and psychologists are treated differently. And the time to see a psychiatrist, the waits are horrendous. We just don't have enough psychiatrists in our country. However, that counseling is a great holding position and support. Training. Training is so important in terms of being able to develop resiliency, for example, and self-awareness about mental health issues that you may be experiencing. Again, being able to identify problems early and get that intervention, the greater the possibility of successful treatment occurring. And again, assessment. You need to be able to gauge the improvements that you're making and make sure that what you're doing is actually working. So that's really key and vital importance. So one of the other key factors in terms of looking at the standard is what we call 13 psychosocial factors. Now these are things that affect people's responses in the workplace to working conditions, for example. And what we're talking about are things like civility and respect, and I've used the words and a couple speakers have used them as well, things like harassment and bullying. How do you begin to address those, bringing in policies that actually prevent those kind of things from happening? Making people feel that they have some control. All too often people in the workplace feel disenfranchised, feel that they have no control, and that leads to things like stress, anxiety, and depression. So again, these are factors that you can deal with if you have the appropriate programs and approaches in place. So how do you begin to implement these kind of programs? How do you begin to implement a standard? Well, there are certainly some key elements to doing that. One of the most important is having that support from leadership at the top at the most senior levels. So it's top down to that degree. If you don't have that leadership, you don't get the buy-in from middle managers who play a very vital role. At the same time, and not to be ignored though, you need the support and feedback from the grassroots level as well. So it's also bottom up. It's not only top down, but bottom up as well. Planning. It's going to be different and unique for each individual employer and program. They have different needs, they have different issues that they're dealing with, so you have to tailor it to your particular organization, your particular company, your particular sector. Implementation. People need to see it being done and rolled out and understand what it's all about. So communication and implementation, again, really key and important factors. Evaluation, again, there's that word again, collecting the data, making sure that you know that what is actually happening is working, and if it's not, identifying the gaps and then coming up with solutions to those gaps so that the program is fixed and so that the program is working. And at the end, you need management to review it to make sure that it's effective and it's delivering on the objectives and goals that you've set out. So in order to get a better understanding, because again, as I just mentioned, it's different for each workplace is unique, has its own particular issues that it's dealing with. We embarked in 2014 on a major national case study involving various partners that had undertaken to implement the standard itself. So what we were doing is sort of trying to help others as well, because what we could see is that many companies and organizations would benefit from the work that were being done by these pioneers, these people that were being proactive and taking on this leadership role. And as you'll see in a few minutes, we worked with big companies, medium-sized companies and organizations, and small, private sector, public sector. So we tried to cover the waterfront when it came to working with this particular program. So what we wanted to do was to look at breaking down barriers, identifying those barriers and breaking them down, determine promising practices. Again, why reinvent the wheel if you don't have to, if you can help support others in the work going forward. Building the strong business case for implementation. And I think, again, looking at some of the work that's been done here in Australia, you already have a pretty impressive business case in terms of moving in this particular direction. Identifying tools and resources that can be shared. One of the things that always amazes me, and maybe perhaps it shouldn't, I've been doing this for 10 years now with the Commission, is how generous people are and willing to share what they've learned, the tools that they've developed, that will benefit everybody. And creating that blueprint for the future is vitally important. So here are some of the companies. We had 40 companies, again, as I was mentioning, from our largest telecommunications media giant, Bell Canada, to some small organizations, maybe less than 20 individuals who were part of a law firm, for example. So we can show you that it works at large level, medium-sized level, and smaller level. One thing that we did find out, though, it's generally much easier for larger organizations. They've got the infrastructure largely in place, many of the things in place, such as EAP programs, well set up HR departments. It's easy to identify people and resources that you can throw at this. A little bit tougher, but not impossible, for smaller organizations that don't have the benefit of those aspects. So again, you can see we were essentially from coast to coast, 40 different organizations reporting back to us. Changing culture isn't something that comes easy, and it's not something that you can do overnight. You're in this for the long haul, and you're not going to begin to see dramatic results or improvements for a period of time. Some of the things that you will see, for example, you'll see an increase in the uptake of services. Some people get panicky and say, wow, you're costing us more money. All of a sudden, more people are demanding support, demanding services. But what we've seen over a 2-year period is that begins to level off and, in fact, begins to decline. And what you also begin to see is a reduction in absenteeism levels. You begin to see a reduction in short-term and long-term disability cases. So in effect, there's a little short-term pain, but long-term gain. But again, it's the kind of thing that if you're going to embark on this, you have to be there and provide the leadership for the long term. So again, I was talking about Bell Canada. It embarked on what I would call partial engagement. So it didn't throw its whole organization behind the program. It has a staff of about 55,000. Instead, about 2/3 of that staff were engaged in the program. They did something really interesting, and they had actually started before we got them engaged. They had developed a scorecard, a 90-point scorecard, which we'd be more than happy to share with you. And things that they were looking at was uptake of services, reductions in disability claims, taking a look at events, taking a look at training programs. So they were measuring all of these kind of factors to help them determine whether or not they were having a positive impact in achieving the goals that they were looking at. So again, you can be really strategic, and it's very practical. And it's not really rocket science when you really begin to put your mind to it. So taking a look at some of the outcomes, some of these companies are a little bit cagey when it comes to sharing too much information. We just write it off to sort of not wanting to give their competitors any knowledge or advantage. So Bell did share some things with us. They talked about doubling the increase in utilization of services, EAP and things of that nature, which is what I was just mentioning before when you see that increase taking place. They also saw a double-digit decrease in terms of disability claims, particularly short-term disability claims. So begin to think of that in dollar terms if you're a company and looking at the bottom line in terms of what those kind of savings are, and that certainly has to make the business case for implementing it. We know that the real reason for doing it is that we want mentally healthy employees. We want employees who are engaged, who are enjoying what they're doing, are productive, and have fulfilling careers. As a few of the speakers mentioned, in Canada, for example, we look at it, 60% of the time your waking hours are spent in the workplace for most adults. That is a large portion of time that you have available that's spent in those workplaces. And as one of the speakers just mentioned, talking about finding friends, talking about finding colleagues and relating to people, much of that takes place in the workplace. Now, here's one of the small firms that participated in the study. This was a legal firm specializing in human resources and labor law, just under 20 employees, and they began to notice things, for example, a newfound awareness of mental health that they may not have been aware of in the past. They were identifying some of those factors that could be seen as harmful in terms of psychological safety within the workplace, health and safety within the workplace. And also they began talking about it more. And that's so important, just beginning to talk about it, to break the silence, to take it out of the shadows and to normalize it really goes a long way. There is probably a greater number of public sector organizations that participated rather than private sector, but there were a number of big private sector organizations, insurance companies, media and communications giants, and other groups as well that participated in the study. So in terms of our preliminary findings, in terms of things that we were looking for, we saw that 72% of the companies that participated in adopting the standard were using those 5 key pillars or key elements that I was talking about, and we saw improvements in that area. That was up from 3 years ago, where it was only about 55% of those companies were using it. Many more companies are now using data. They're now measuring it. Again, be evidence-informed when you're developing programs. Make sure that you're measuring them so that you know that you're achieving the goals, and that helps support the business case behind it. Some of the programs that were implemented, respectful workplace programs and policies, for example, education, creating more awareness within the workplace and informing employees so that they were more aware of their mental health and what was going on within the workplace. More EAP services and supports, as well as I just mentioned a second ago, enhancing knowledge. So we're going to move into a different realm right now, and there are a couple people I know in the audience know the answer to this, so I'm going to ask you not to tell anybody else. But can anybody hazard a guess what this is? What this little squiggle is? Pardon me? An ear? It looks like an ear. Nope. Stomach? No. So this is the Greek letter for stigma. This is sort of the origin of the term stigma. Anybody care to hazard a guess on how the ancient Greeks used this? It was a mark or a brand. They had a stick called a stig, and they would carve it on people that were to be shunned, that were considered unworthy. Prisoners, slaves, criminals. Now, fortunately for us, we moved a long way from the ancient Greeks, but stigma is still alive and well. And we know that in terms of the barrier in Canada, 2/3 of people with a mental illness won't seek help, largely because of the stigma. They often describe the stigma that they experience as being worse than the illness itself. They're afraid to come forward. They're concerned about things like constructive dismissal. They're concerned about, again, some of the stereotypes and misconceptions that people have about mental illness. So it's a huge challenge that they're dealing with in terms of trying to overcome that stigma and get buy-in. But I think we are beginning to make breakthroughs, and people are beginning to talk about it more openly and more comfortably. So why reduce the stigma of mental illness? Well, it goes back in a way to what we were talking about in the programs. You can begin to see, and this is one of the things that's so important, is making people comfortable at early help seeking. The earlier somebody gets help, the sooner they're likely to get better, the more positive the outcomes. Increased productivity, again, that early intervention and comfort and support that you need within the workplace environment. When you're talking about changing culture, you want a workplace environment that's supportive, that gets behind its employees so they know that it's okay for them to come forward. That cultural shift that we were talking about in terms of attitudes and behaviors, not taking those negative attitudes or beliefs and turning them into discrimination, and greater acceptance of mental health in the workplace. And again, ultimately, positive outcomes for those people that are dealing with mental health problems. So one of the programs that we've also been working on, in addition to the standard and the case study, is a program that we call the Working Mind. Its origins start with our Defense Department. They developed a program called the Road to Mental Readiness. And it was designed to help troops going into combat be more resilient after what they knew they were going to be exposed to in combat and within theaters of operation. So we were able to take that program because we saw a lot of positive benefits and sort of translate it into something that was usable within the general workplace, taking away a lot of the military terminology, but using some of the fundamental tools that are part of the program, reconceptualizing it. So one of the things that's important about the program is that its goals are to increase help seeking, create a more supportive environment, to break down that stigma barrier that exists, and also to give people the tools that they need. One of those tools is something that we call the mental health continuum. And again, I think it's the simplicity of the program, and leave it to the military to come up with something that's simple and works. It's a simple little color chart. You'll see that it moves from good to poor along a gradient. That gradient moves back and forth. So you're reconceptualizing how you look at mental health and mental wellness. Traditionally, we looked at it in black and white terms. Either you're healthy and able to work, or not healthy and shouldn't be working, shouldn't be there. This identifies that at any given time you're somewhere along a continuum. And even though you may be experiencing issues, it doesn't mean that it's going to impair your functioning doing a particular job. What this program does in particular is that it reduces the stigmatizing labels. It's not meant to be a diagnostic tool at all, but rather one of self-awareness. It's a preventative tool, so that people can begin to identify some of the indicators that are there that show that they may be moving into dangerous waters. So each phase in the continuum, and normally we show the entire phase, and I won't do that just because of time's sake, but there are indicators such as sleep, for example, which is a great bellwether. It's sort of the canary in the coal mine. If you get 6, 7, 8 hours of sleep a night, depending on the individual, that's a good place to be. You may be in the yellow, which is reacting, where I was this morning at 3 o'clock, sort of thinking about my presentation. How many of you have had that unexpected 3 o'clock in the morning wake-up call? pretty healthy actually. It sort of gets you focused, gets the adrenaline going. As long as it's not prolonged or sustained over a long period of time, you come out of it okay. And in fact, sometimes it's helpful. But imagine if you're not sleeping for weeks on end, or sleeping very well for weeks on end. How well do you think you function? And are you particularly easy to get along with? Would your work colleagues sort of say that you know, you'd be voted Mr. or Miss Congeniality? Probably not. Now imagine that you get to the stage when you're moving into the red, which is ill, and you may actually have a diagnosable mental illness where you can't fall asleep or you can't wake up. You're having serious nightmares, all of those kind of things. So these are really simple factors that you can look at. Changes in mood. Going from, well, maybe not being as patient as you might be in the yellow with somebody, having a little bit more difficulty focusing, to getting into displaced or sarcastic humor, withdrawing, becoming negative. All of these kind of things are certainly things that you can help you become aware of what your mental wellness or mental health state is. So what we've also been able to do is to direct people to strategies and tools that they can use to keep themselves in the green, or if they're beginning to slip, move back into the green. One of the tools that we've identified, we thought it to be a promising practice initially, but we've now moved and think it's a best practice, and you saw some wonderful examples of it today here with Carolyn telling her story and seeing the stories that were on the screen, but something that we call contact-based education. I think that the way we're programmed, the way that we can empathize with people and actually see that those stereotypes and misconceptions are wrong. People can get better and do get better. There is that hope and there is that recovery that can take place. So some of the coping strategies that we talk about, I'm running out of time, but things that are basically have been around for a very long time and are well proven. CBT theory-based elements, smart goal setting, mental rehearsal, positive self-talk, things that have been used by high-performance athletes, for example, for a very long time. Diaphragmatic breathing. When we're dealing with first responders, we call it tactical breathing because it sounds a little sexier to them. But again, reducing cortisol levels, adrenaline. It's amazing what happens when you do deep breathing. Just to give you an idea, and again, because of time, I won't get into it, but I'd be more than happy to share the research results. We have 2 papers right now that are being reviewed for scientific journals, but we've seen really impressive impacts. And we're also working with the University of California, who's come up with a shorter version of the program. And again, they're seeing the same consistent improvements across the board with the program. So what we did was we looked at qualitative research as well as quantitative, or quantitative and then qualitative. So in other words, focus groups and finding out about whether or not the programs actually worked for individuals. And again, we're very, very happy to see what the results is. A 4-year study involving close to 5,000 people, first responders, and another 1,000 or more in the general workplace. And we're able to use matched sets of data and then do post evaluations as well for those researchers here in the group. Again, as I said, I'd be happy to share it with you. We've only actually shared some of the details with a few colleagues in a conference, the World Psychiatric Conference in Copenhagen, and the papers will be coming out shortly. So that's it for now, and again, I'm going to be here for 2 days, so I'd be more than happy to talk with you if you have any questions, and go from there. So again, thank you very much for being such an attentive audience. Appreciate it.